Greg, what can our state government do to ease the burden of health care on our citizens?
You know, there's a couple things that we can do. First, we need to be preventive. We need to pass regulations that will help stop the federal government from raining down these mandates on us. So if we're preventive and do that, we can do that. The second thing we need to do is, you know, I'm worried about as medical costs rise and insurance premiums rise and costs are cut, sooner care is going to be moved way to the back burner. You're going to see doctors, it's going to hurt the least of us because you're going to see doctors who have satellite offices in the most rural parts of our district start closing those offices down. So we need to form a task force, look into this and say, how can we keep those doctors that have these satellite offices in a rural area, how can we keep them there? And what can we do to make sure that they get paid and they get paid quickly and fairly? Because this is really going to hurt the least of us the most and then continue to work itself up the chain.
I think one of the things that the OSU Medical School is doing is they're doing scholarship programs so that kids that, we've got a couple that just graduated from OSU that are now in medical school, and there are programs where after they finish, if they go do like a 5-year stint in a rural community, then they get their scholarships, their bills paid from school. Basically, and one of our good friends is now in Duncan, and she's just a really neat girl, and she's making a really big difference in Duncan. You know, Duncan didn't really have a general practitioner there, and she's making a big difference. So I think the more that we can support people who are getting their medical degrees and encouraging them to go to those rural places, I think is really important. But also, I think, you know, some of the mandates or restrictions that we put on nurse practitioners, I think that they could do a lot of health and wellness checks, and you know, I think we need to take some of the money from the federal government for, you know, those funds. And, you know, there's 18 states that aren't taking the money, and I think that would make a huge difference for us to do that. So.